Hi, everyone. It's John Benko, the Director of Nursing, and I'm here on the Belfair campus in Shaker Heights, where I was screened this morning by the health screener in the health clinic where I report to work, and they tell me my temperature is 98.2, and I have no other symptoms of the COVID-19 virus, and I'm feeling great, so I came to work. I just want to point those things out to you because I know you're all being screened. It's very important if you're coming onto any of the Wingspan affiliated properties that you get screened immediately and make sure that you have no signs or symptoms of the COVID-19 infection. We don't want to bring that onto any of our campuses. All of our residential clients are screened daily a couple of times. We have nobody with a fever and nobody with any signs or symptoms. Happy to report that we have had none of our residential clients come down with COVID-19. So that's very good. And we've only had a handful of employees. Again, very good. These numbers have been looked at by the local health authorities and some of the health leaders, and those numbers are very good. Other organizations of our size or smaller have had a much higher rate of infection. This is all due to the hard work each and every one of you are doing. So thank you for that. We know that some of this is difficult, but what we have to point out is the COVID-19 virus is not going away. So everything has changed. The way that we do our jobs, the way that we do our shopping, the way that we run our daily lives, the way that we go to the store, all of this is new, and it's going to continue to stay new. We are opening things up. The financial burdens on society are great. We need to have things open. We need to provide services. We need to get services both for ourselves and our clients, and so things are opening up. We are doing that in a very measured, a very deliberate way here on campus, so we will start having some visitations. Those are very much under control. We may start having some visits off campus for some of our clients. Again, very controlled, very much monitored. We need to keep the screening up. We need to keep the surveillance up. We know that this virus will be around for a long time, and we know that we have vulnerable populations, both amongst ourselves who work here and the clients that we serve. And so we have to do everything we can to mitigate that risk. So thanks for your efforts in that. And the way that you're going to continue to do that, again, screen yourselves. If you're not feeling good, don't come in. When you do come in, we got to keep those protocols up. You should be washing your hands often, right? Good hand hygiene. We need to sanitize our workspace. We have certainly our environmental team out there, but we also need to do this ourselves. Wipe your areas down. All flat surfaces, doorknobs, light switches, desks, keyboards, etc. And you should be using a face covering. This is mandatory. This isn't new. We're having some challenges with this on campuses. So you should have a cloth face covering, right? We've got you one. This is a face covering, not a medical mask. It's just a face covering. You just need to wear it anytime you're with anybody else. So if you're not in your house or in your car or in your office by yourself, you should be wearing a face covering. A face covering has been proven to work. We know that some of this science was not available to us, but we've got some studies now, and we see that we are not infecting each other in the workplace as we were when this virus first came out. So what that face covering does, when I'm wearing a face covering, that protects all of you. It keeps my germs to me. So if I were to cough, I'm not spreading the virus if I had it. And if you were to cough and you had your mask on, you wouldn't do that. We know that talking also aerosolizes some of our saliva and gets out there until gravity can take it down to very small droplets. So until that hits the ground, it's out in the air. So if I'm wearing a cloth mask, that's keeping it close and it's slowing that vector down. We need to protect each other. I'm wearing a face covering to protect you. You need to wear one to protect me. And most of all, we all need to wear them to protect our clients, right? So please make sure that you have a face covering. I know the agency has provided at least one for everyone. If you don't have one, see your direct supervisor or unit director. We'll make sure that you get one. I just want to point out again, those are face coverings. These aren't surgical masks. These aren't PPE. We're just doing face covering. If we needed more enhanced PPE, we'll get that to you as well. We've got some training videos out there for that, and we'll certainly make sure you know how to use anything that you need to use. So in the meantime, please keep the face coverings going. Physical distancing, 6 feet whenever possible, spread out. If you can work somewhere else, please do that. In other words, instead of being in a very close office, if there's another workspace, spread out. If you're having meetings, please do them virtually. If you're in a room, pay attention to the number of people that could be in the room. You need to spread out, stay 6 feet apart. If you have to be closer than that, we have to be very, very careful. And we all have to, of course, maintain those face coverings. That is the mandatory rule. We're always in face coverings when we're around other people, and we're still keeping that 6 foot distance whenever possible. We know there's some exceptions out there when there's a clinical emergency, etc. We know when those happen. Those are well documented. documented, but for the most part, we should all be wearing masks. We're not doing that. We need to get better at it. So if you have questions, certainly reach out to your divisional leadership. You can always reach me at Benko J at Wingspan CG. If you need me to come and talk to your team and your team members or associated teams, reach out again through your supervision and get a hold of me. I'm happy to make those arrangements. If we could do some sort of a specialized training video for you, we'll do that. If I can come to one of your team meetings, I'd be happy to do that. We want to do whatever we can to keep all of you safe, all of our clients safe, and to keep providing these essential services. As we're expanding things and opening things up, it's very important that we stay safe. So we need you to do that. So please, again, face coverings, hand hygiene, physical distancing. If you're sick, don't come in. Participate in the screening. Sanitize your work areas. We also know this is a stressful time, so what we really need you to do is mind your stress. I mentioned this many times, spread kindness and not virus. When we're kind, we're happy. When we're happy, our immune system works great. So do what you can to be kind to each other. Everyone you know is going through the same thing. We're in the midst of a global pandemic. This will be here for a long time. We don't have a vaccine. Even when we get a vaccine, it has to go into mass production and mass distribution, and it'll be a while until we're all protected. And so we need to protect each other in the meantime. If you're having problems with stress, do what you can. Get some exercise. If you need help, get help. Talk to a therapist. Talk to a friend. Reach out to the Employee Assistance Program. Reach out to HR, your immediate supervisor. They can get you that information. If they can't, or you're having a hard time reaching them, or you would rather just email me at benkoj@wingspancg.org, I'll get you that referral information and you can get the help that you need. We certainly want you to be healthy, and we want you also to look after yourself. We do know that mental health universally is in a bit of a crisis mode now. We're not exempt. Realize that you're going to have some stress and it needs to be taken care of. So look after yourself and do what you can to look after each other. Speaking of looking after yourself, in just a few short months, I will be bothering you about the flu shot. We're going to have a flu program. This will be headed up by Jeff Peace. He's our director of nursing over at Applewood. I'll certainly be working with him. We will be talking to all of you. We need participation. When I say we need it, that is the world. Everyone has to participate in a strong flu vaccination program. We cannot have folks getting the flu and COVID at the same time, and we cannot be confusing the two. So we need all of our resources to, again, take care of sick folks who have COVID, and we can prevent the flu, or at least prevent a bad case of it, by getting a flu vaccine. That is something that the agency has made a commitment many years ago to provide free to all of us. So all you need to do is show up and do it. We will get more information to you, but it's going to be more important now than ever. Certainly look after yourselves, your families. Those vulnerable in the population are doubly at risk, so we need to make sure that they get their vaccinations as well. I'll continue to preach that to you as time goes on. If you have questions, reach out to me. I'll do what I can to educate you. Anything we can do to help, let us know. We're here for you. We appreciate that you are here for our clients. We're doing a great job. We've got essential services, and our clients need us more than ever. And we're humbled, certainly I am, by looking at the work that you do every day. You get up and show up and make sure that our clients are looked after, and we appreciate that. And you are our heroes. If there's anything I could do to help you, again, reach out by email. Give me a call. In the meantime, I'm going to ask you, as I always do, to please wash your hands and stop touching each other. Have a great day. We'll talk soon.